As the virus crosses borders and spreads further, clinics, airports and border checkpoints try to contain it. At the US-Mexico border, officials stopped those showing flu symptoms like coughing or sneezing. International airports use temperature scanners to determine which passengers have a fever. Swine flu has now been detected in 8 countries. Testing in New Zealand has confirmed several cases among a school group that had recently visited Mexico. Officials say they're expecting more positive test results and are monitoring a further 43 people for possible signs of the flu. In neighbouring Australia, the government has approved new powers to detain and disinfect people suspected of carrying the virus.
We have no reason to believe that the Australian public will be anything other than fully cooperative, but we do want to ensure that we have powers to act quickly when we know in a situation like this that the circumstances can change very quickly.
The World Health Organization says the crisis is now global.
We have to be mindful and very respectful of the fact that influenza tends to move in ways that we cannot predict very easily.
Cuba was the first country to ban all travel to and from Mexico. Governments in Europe and North America have recommended against all non-essential travel to Mexico. Despite the warning, some travellers at different airports say their plans will not be modified by the outbreak.
There
were doctors distributing masks and asking who has had a fever and things like that, but I think the situation is a bit exaggerated.
You know, there's some reason to think that we might get sick, but I don't think there's a reason to think I'm going to die from this, so I didn't feel too badly. I would have gotten a mask if the opportunity presented itself easily, but it wasn't easy. So.
Experts say they are working on a vaccine, but in the meantime, sales of flu medicine, face masks, thermometers and hand sanitizers are on the increase. Wayne Hay, Al Jazeera.